Hi friends, I'm Dr. Sunil Sable. We are continuing with the series on the diet, obesity and diabetes and how to reduce your belly fat. In this lecture, we are going to discuss about insulin resistance. We know that the main cause of obesity, diabetes, metabolic syndrome is insulin resistance. This is a new theory of obesity and diabetes. So why this insulin resistance is occurring? Now, insulin is a hormone which is secreted by the pancreas. When we eat, the carbohydrates are converted into glucose, and this glucose is utilized by a cell as a fuel. But this sugar to enter in a cell, there is a lock, and this lock is opened with the help of a key called as insulin. Okay, so insulin is very essential for maintaining blood sugar. Now we know that everything has to be in an optimum amount. If it increases, it causes problem. If it is less, it causes problem. So in type 1 diabetes, there is less insulin, it causes problem. And in type 2 diabetes, it is because of excess insulin, and excess insulin lead to resistance, it causes problem. Okay. So why this insulin is increasing? When our ancestors used to eat unprocessed food, complex carbohydrate, the insulin used to increase in a moderate amount. But because of the change of our dietary pattern, we have started eating refined carbohydrate. What do you mean by refining? For example, if you eat the wheat, our ancestor used to wheat by stone grounding, so that its covering, the fiber used to be remain there, the vitamins, the fat used to remain there, and it used to decrease its glycemic load. But because of the modern milling, we are removing the fiber, the covering, we are removing the fat, and what remain is only a fine powder. It also contains amylopectin A, which increases sugar exponentially. So we are eating wheat which is very refined, which is increasing sugar. We are eating a lot of refined carbohydrates which is processed by various multinational companies, and which is available in the form of packaged food or pizzas or burgers. So this industrialization remove fibers, fats, and make it refined, and which raises the sugars exponentially. So refining is one thing. Second, we have started eating a lot of sugars. We have started eating a lot of high fructose corn syrup. So this high fructose corn syrup is present in a lot of cold drinks, in syrups. So it is increasing the sugar and increasing the insulin level. Third thing, we are eating a lot of processed animal food. The protein in animal food is also insulinogenic. The milk is also insulinogenic. So a lot of milk also increases the insulin. So these are the factors which increases the insulin. Now, increase in insulin doesn't cause insulin resistance as per insulin itself. Because when we eat, the insulin increases, and after a few hours insulin decreases. Okay, so it gives rest to the insulin between our meals. So traditionally we used to eat 3 times: breakfast, lunch and dinner. So after breakfast, for few hours the insulin will increase and it will reduce, and for few hours it will be in a basal level, and again during lunch it will increase and it will fall, it will remain low at a basal level till dinner. So initially we used to be in 50% insulin deficient and 50% insulin excess state. Okay, but nowadays, because of change in modern eating habit, because of snacking, we are eating more frequently. We are eating 5 times, 6 times, 7 times. We keep on eating, and every time we eat anything, the insulin shoots up. Okay, so now we are 80% insulin dominant state, insulin excess state, and only 20% time insulin deficient state. So insulin is persistently elevated in our body, and according to the law of a body, anything which increases persistently, the body develop resistance to it. It is a protective mechanism. Okay, otherwise we will not survive. So because of the refined carbohydrates, the insulin is increasing excessively, and because of frequent eating habit, it is persistently elevated in our body, causing insulin resistance. Okay, and as the insulin resistance develop, the body has to produce more insulin to have same effect. So again the insulin increases. Now this insulin has other side effect. It causes lipogenesis, so it store fat, so obesity will increase. It is also causes atherosclerosis, so heart disease will increase. So it is found that those people who take drugs like sulfonylurea, which increases insulin level, or those people who take insulin, the incidence of heart diseases are 40 to 80% higher than the person who use metformin, which doesn't increases the insulin level. Okay, so the insulin and insulin resistance is the main thing in obesity and diabetes. In next lecture, we are going to see how we can deal with this insulin resistance, reduce our belly fat, and reverse our diabetes.